Evening, everybody. Welcome back to another one of my live streams. And today's topic is laxatives, which is my specialist subject. I'm obviously the running joke that I am very good at talking poop. But just to give you a little bit of background, I've got Ehlers-Danlos syndrome, so I myself have struggled with IBS and or constipation. And so when this subject came up at work, I've always looked into it and have always shown more interest in writing laxative guidelines to anybody else. So I got given the job. I've wrote laxative guidelines for my local area, and then I've actually had quite a few other local areas in England copy my laxative guidelines. So I've been, very proud of the fact that people have actually wanted to take my work and have really appreciated the amount of background research that I've done into laxatives. So welcome everybody. Welcome DC, welcome Coconut, welcome Rosie. I've already had absolutely tons of questions. As you can see, DC's filled up the chat, but before then I'd also had questions asked on my Facebook post and on the YouTube's comments page. So I've wrote them all down on the side here, but keep asking your questions in the chat and I will try to get through as many as I can. So I'm just going to do the official disclaimers. So obviously the information I am providing is for educational purposes only. So please always make sure that you do contact your own healthcare provider for personal situation and treating your own health conditions. And I'll just do my banner so that I can encourage you to like, subscribe and comment. The more that you do this, the more that YouTube will spread out my work and I can get a bigger engagement and be able to help more people. Hello, Amanda. Is that Mocky Doo? I like the sounds of that. Yes, Ehlers-Danlos syndrome. I've got hypermobility type EDS, which is the one that doesn't show up on genetic testing. Obviously, there is the other varieties that do show up on genetic testing. But yeah, I have talked about my EDS in previous live streams. So if you did want to go back and look at any of my previous ones, especially the one where I talked about collagen, I really went into depth about my EDS on there. And obviously, yeah, as you probably are aware, EDS means that my collagen is stretchy. So that means all the ligaments and tendons that support my joints are stretchy, hence the hypermobility. All my joints are hypermobile. I can do lots of silly tricks with my doesn't show up here very well. Making sure that I can do thing, but as well as the collagen in my joints that are stretchy, the collagen around the smooth muscle in the intestine walls is stretchy. So because it is a long tube, your intestines are basically just a long tube from your mouth to your anus. Food travels along it. It's more stretchy than it should be. So sometimes if stools sit there, it expands and the stools end up wider, and that can, if they end up losing water, cause constipation. Hi, Sam. Great to see you here again. Not supposed to be able, but yeah. So one of the indicators for EDS is being able to pull the little finger up to vertical. That is one of the indicators, as is being able to pull your thumb all the way round to your wrist. It's not just that. Some people can do that, and they've only got a hypermobile in the fingers and not in the rest of the body. You've also got to show it in your elbows, your knees, your back for it to be generalized hypermobility. And also some people that can train themselves to be hypermobile, such as some gymnasts. Oh, yeah. Yeah, all of my joints have gone behind, and I also do a silly thing that I can't do it. I can do a silly thing with my thumb where I can knock my the joint of my thumb backwards, which you shouldn't be able to do. But everybody in my family can. So when I was growing up, all of these tricks and weirdness, everybody in my family could do it. So I knew no different. So we knew no different to get a genetic condition diagnosed when everybody in your family has that genetic condition. that is the problem with genetic conditions. Oh, yeah. So Lynn, I'm just on a sidetrack on EDS and hypermobility, because that's the reason why I've got IBS and constipation, and why I ended up taking the lead at work to look into laxatives and constipation, and why gastroenterology as a whole ended up being my specialist interest. Yeah, so really slow digestion and peristalsis. So yeah, speeding it up. So that is one of the things that we're going to talk about as we go through all sorts of the questions on treating treating constipation. So it sounds like the majority of questions I've actually got so far is on actual treating proper constipation. And that's probably because the majority of people at some point in their life have been constipated. And there is actually a good proportion of people struggle with chronic constipation on a daily basis, but it's never talked about. People don't talk about their bowels. It's one of those subjects, you know, we always have to make up every other word under the planet to sort of go, oh, I'm going for number 2, or think. People just do not talk about their bowels. Unless you're like certain older relatives who insistent on talking about the bowels, but that's another issue. Yes, stomach issues and EDS, very connected. So, hi, Mum and Dad. Hi, Laurie. Oh, it's great to have all the usual people here again. Really enjoy it. So yeah, so the constipation is a much bigger deal than everybody ever knows about. Plus, it is a much bigger deal to people's health than people realise. It's not just an extra sort of condition that people sort of suffer with. It really can cause immense problems for people. It can actually lead, in its most serious cases, it can actually lead to blockages and perforation. And obviously, a blockage of the gut, it just stops everything going through. And if you can't absorb anything, then your body can't do anything. You need to be absorbing nutrients. So yeah, constipation is essential. It is essential for our bowels to be moving. Plus, a perforation of the bowel is a medical emergency. Basically, you end up with the stools that should be within the intestines, which is full of bacteria. And yes, we know that there's a lot of good bacteria in there, but there's also bad bacteria in there. And if that gets into your abdomen, that's automatic sepsis in your abdomen and a medical emergency. And if you're not basically in a hospital at the time of the perforation or able to get there straight away and get an operation, there's not much chance. So yeah, constipation does need to be looked after. And there's so many other conditions that can cause constipation, or so many other conditions can get treated with medication that can cause constipation. And it all needs to be looked at and preemptive. We need to be making sure that things are working naturally and properly all the time, because if we can't eat properly and get the proper nutrition and absorb that nutrition, then we cannot be healthy and be able to treat any other conditions. So as with always, if we can prevent the constipation, the better, because making sure that we keep our bowels as healthy as possible is the way forward. And then we don't need to actually intervene. And as with a lot of conditions, lifestyle advice is the main way forward to prevent any problems and prevent issues. And this even does occur if you've got a condition that means that your bowels are more lax and are more prone to constipation, then that means that unfortunately you've got to really put more effort into the lifestyle. And unfortunately, the way the Western world and the Western lifestyle is opposite to what is good for our bowels. So fluid intake, our bowels need continually to be soft. And if we start getting dehydrated and our blood system needs more fluid, the one place it can go to get some excess fluid on a quick basis is out of our bowels. So it will suck any water out of our bowels if we're dehydrated, usually just in an emergency. Maybe if you've gone walking across a desert for 24 hours, it can pull it out on the premise that you are then going to be drinking again, and it will then get replaced. But when people are chronically dehydrated, your body's chronically trying to pull every little bit of moisture out of your bowels and out of your stools, that then they just are that hard that it doesn't matter how much Paracelsus tries, it can't move it. It's a solid lump, it won't move. And so fluid intake is one of the most important things. And obviously you'll see everything about fluid intake is so important for everything else, for your kidneys, for your blood pressure, for so many other things. So fluid intake, not excessive fluid intake, but a decent fluid intake. Exercise, and this did roll into somebody DC's already asked. So activity and exercise improves your bowel movements, because although it is a long tube going through your system and it has its own peristalsis, actually doing exercise, increasing up the blood flow, moving those muscles, jiggling it about basically, helps move things along. You probably do find if you've gone and done some exercise, after you've done some exercise, it does make going to the toilet afterwards easier. And so a bit of gentle exercise each day can really help, especially if you've got into a routine, so that you can do a bit of gentle exercise. It only has to be walking or swimming. It doesn't have to be vigorous. Can help just move things along and things. So this was one of the questions earlier. If activity improves constipations, what about options for people that have got low mobility? And that's a very good question. For people that are either wheelchair bound or bed bound, they can easily struggle with constipation. And sometimes people, automatically give them laxatives to overcome this. But although we've just talked about the body doing exercise to improve the bowel, you can actually do it manually as well with massage of the stomach. So if you do a massage in I want to say clockwise way, up from your appendix, across the top and down the left-hand side of your body. So up your right-hand side of your body, across the top, down the left-hand side of your body. And if you do that movement round, it can really help. Plus, another one's good is the cycling legs. And this is one that is quite often done with young babies and toddlers to help them when we're struggling with constipation, is to do the cycling of the legs and then the movement on the body to help move things along. So, and then the other one, so fluid intake, exercise, and then lastly is fibre. And they always just say about fibre, it's not just to do with fibre. Yes, increasing fibre intake is the main bulk of what goes through your stools. But they have found, and there is fibre supplements, and you probably know of so many companies and supplements saying fibre with probiotics, with all the essentials to try and improve, detox, cleanse. that's not what's important. The important is when you are eating your normal diet, your health, the normal food that you're taking in, that it contains enough diet. It contains enough fiber along with all the other essential nutrients that you require. Just taking a fiber supplement on its own can actually cause even more problems. And there is the problem of if you just take a fiber supplement. I don't know if any of you ever have taken anything like fiber gel or psyllium husk and things. If you take it, if you try and make it up with not enough water because you're thinking this is gross stuff, I want to make it as small as possible. So you make it up with only a little bit of water. You give it a bit of a stir. You've taken a sip, gone, ugh, you've walked away. You come back half an hour later, and it's a solid gloop, and it's impossible to drink. And actually, that is the problem with fiber and taking fiber supplements. Is it only works if it goes along with plenty of other food and fluid. And it itself can cause a blockage if it's not taken along with enough food and fluid at the same time. So fiber is very important, and it's getting about different sources of fiber in your diet, because there's insoluble fiber, soluble fiber, and they come along with different things for feeding your gut microbiome. And I think I talked a lot about the gut microbiome in the previous live stream, which was on antibiotics and prebiotics, probiotics. So you do need to be getting, and as we discussed there, the Zoe project sort of shows that getting sort of 20 different varieties of plants is much more important in feeding your gut microbiome and feeding them with the fiber than just taking a fiber supplement. So I'm just seeing that there's even more questions coming through. So yeah, so that's the problem with C. difficile. So C. difficile is a really nasty bug that basically puts a toxin into your intestines and just basically, yeah, as you says, obliterates your gut lining, and literally things just fall straight through you. And for a long time after then, it can take a long time for your own body to put back the good bacteria in there. Also, you've the lining takes a while to sort of relax back into the correct position. So it's been expanded out. It needs to sort of shrink back. And it can be sort of a vicious circle of being able to get back. I would say you probably need to be looked into if it continue to get worse and not get any better, because it may have just flared up another underlying condition that's under there, which does go back to my another question that DC asked at the start was, can your body become dependent on laxatives? Now, it's always been thought that if you take a stimulant laxative every day, that you'll end up dependent, that you can only go with a stimulant laxative every day. And they never really knew whether this was chicken or egg. And they did actually do some studies on this to have a look to see whether the people that were on the long-term stimulant laxatives, was it the long-term stimulant laxatives that caused them to have chronic constipation, or was it the fact that they were prone to having chronic constipation due to some underlying pathology that they ended up requiring a stimulant every day? And it does turn out that it's probably more likely that they already had an underlying pathology that meant that they were prone to chronic constipation, which is why they became reliant on laxatives rather than the laxatives actually causing the body to become dependent. And so now your body doesn't become dependent on laxatives, and you can actually, if you don't need laxatives, you can wean off them and wean onto a healthier lifestyle and digestion, as long as there is no underlying pathology that is causing the constipation. Unfortunately, you might find that you do still need them because there is something underlying. But no, your body doesn't become dependent on laxatives as such. Not like with sort of opioids, whereas this is one of the problems with, you do become a bit dependent on opioids for pain relief. But when you take higher and higher doses of opioids, that doesn't, the side effects of constipation from opioids, you don't get dependence from that. That does still carry on escalating. Yeah, I always, sometimes you know that a certain activity is going to cause it. The other one that I was going to say is quite often people will start eating and go and then say the food goes straight through me. No, the food that you've just eaten doesn't go straight through you. It's still in the top half. It's still in the stomach for a couple of hours and then small intestines for a couple of hours. However, it is one long tube that is very interconnected. So if you start at the top, it's a bit like a hose pipe. If you put switch the water on at the top of the hose pipe, it's got to push its way through and it'll start pushing it out. So as you start, even as you start thinking about eating and the saliva, it can start the peristalsis. And you probably all got that member of the family that suddenly it's time to do the dishes. You ask them where they are, and they're up in the toilet, getting out of the dishes. But that is actually a normal thing, even if it is very annoying for the people that end up having to do the dishes. I would just re-alter things so that you wait until after they've done that and then go, now it's time for the dishes. But that's always something to do with children as well. And I am going to go back to the question that I got asked was about young children and toilet training. So one of the points is when people can start seeing constipation is when people start toilet training. So up until toilet training, they've always had the nappy. So if they've got actual constipation, you've got it treated by the doctor, and it may be because there was underlying conditions and they might need sort of checking for allergies and such like. But once they start toilet training, behaviour comes into toileting. And it's not fun to go sit on potty for a while. It takes you out of playing. It takes you out of knowing what's happening in the house and such like. And also, they quite often, they just don't like it. They don't like the texture. They don't like anything about it. So toilet training and holding can be a big point of when constipation starts. And some people's answer to that is by giving laxatives. In a way, that's not the answer, because actually that takes away control from the child. It makes it worse for the child because then they have less control over being able to hold it as you normally should and going at an appropriate time. So jumping straight to laxatives when they've got constipation due to holding isn't always the answer. What I would say is that is a whole area where you need to actually be getting support around toilet training, holding. There's things that you can do to try making it sort of that, like I've just said, after you've eaten, that's usually a good time when children go. No, when they used to go in their nappy, if they used to always go half an hour after they've had a feed, that's when they would then need the nappy changing, then take that into their toilet training, and that's when you would give them chance. And it is fine to sit them on the loo with a book and say, just sit there 10 minutes, see what happens, to make it fun so that there's no pressure if they do and they don't. And if they do, great. If they don't, well, we sometimes go. We think we wanted to go when we didn't. So it's realizing that kids are the same as us. And sometimes the bodies don't always give them the right signals. Sometimes your body gives you a 2-second signal, and allowing that for children and not shaming them for that and helping them with the training. But I would say one of the best resources is Eric. So I'm going to try and see if I can share screen again. So share screen. I have put these resources that I've been looking at. Let me go back to check that I'm sharing screen correctly. Yep. So eric.org.uk is an absolutely fantastic resource for helping any parents of children with anything bladder and bowel, incontinence, toilet training, bedwetting, everything like that. They are an excellent resource, and that's where you need to be going and getting help and the resources. And obviously, I like the title there. It doesn't take a break over the holidays. In fact, sometimes things get worse over the holidays because you're out of routine. You don't have the normal routine of getting up, getting breakfast, having the time. And you're eating fun food all the time, which may not have the same fluid content or fiber content that you're used to. So I will have all of these linked below. Yeah, so things that move along way too easily. Again, some of the same advice of fiber intake. Fiber should be a regulator. So ensuring that your body has enough fiber should help slow the process. Sometimes it can be adding in a bit more protein and a bit more fat to help slower your digestion down so that things don't move along. If you are continually having diarrhea, I would always say talk that through with a health professional to see whether, because diarrhea usually is more of a signal of underlying allergies, intolerances, and maybe any inflammation. So if you do, it's always worth going for the testing for celiacs, for inflammatory bowel disease and such like. But if there is a problem, then yes, there are things to gum things up a bit. And actually, this is by using the side effects of medication. So the side effect of opioid medication is that they bung you up. So they realised that because they used to old-fashioned, you used to get your kaolin and morphine, which kaolin and morphine was used to bung you up. No longer sell that over the counter. We can't really sell morphine over the counter anymore. So then people would use codeine over the counter to try and bung them up. But the drug companies realised that, and then they actually developed loperamide. And so loperamide is an opioid that doesn't actually pass systemically and doesn't actually have any pain relieving effects, and also doesn't pass into the blood-brain barrier, and has no psychoactive effects either. So loperamide is a tablet that can be taken. It does get over promoted and overused. What I would say is it's fine for somebody if you've got like IBS and you know exactly what your diarrhea is from, and that you're just taking it so that you can go about your daily activity and not requiring to need a bathroom close by, but then you are allowing yourself to actually go to the toilet at regular intervals at other points of the sort of day. So if you're needing to take 2 a.m. so that you can go out and take a train journey because you know full well you don't want to use those toilets, but then you're allowing your body to actually naturally be fine, then that's okay. What I would say is if you've got diarrhea because you've got an infection, do not bung yourself up. If you've got a virus or a bacteria in your intestines and your body is causing you to have vomiting and diarrhea, it is to get that toxin out of your body, and you must let that toxin out of your body. If you try and hold it in there, then you can actually get something. You can make the infection worse, and you can even get something like toxic megacolon, where basically it will just hold that bacteria in there. It will grow and it will grow and it'll expand in your intestines. You basically caused a bung and stopped it coming out. And again, like I said at the beginning, that can be a medical emergency. So if you've got an infection, allow it out. For as much as you are losing either end during diarrhea and sickness, try and replace that fluid with either normal fluids and salt, and or with rehydrations. So oh, don't worry about that, Sam. Anybody who's had a baby has had that. With babies can manage to get poo wherever you never thought they could get it. So now one thing I am going to mention is sometimes people think that either their child or themselves have diarrhea, but they are actually constipated. And this is for something that's called as overflow diarrhea. I will actually go back. So this might be better if I go back to explain what a normal stool is. I'm going to. So everybody, I hope nobody is eating at the moment and on this. Unfortunately, I'm a pharmacist and I can eat and talk about poop with no problems at all. I'll go back. So we have the Bristol stool chart. And this is the kids' version because I like the kids' version. I find it much more exciting than the original version, but you have what we call the Bristol stool chart, and this is what doctors and healthcare professionals will use when assessing poo. So some people can go once a week, and that's absolutely fine. Some people can go 3 times a day, and that's absolutely fine. When it comes to whether you've got diarrhea or constipation, it is the change from the normal in regards to the frequency that's important, not necessarily the frequency. However, when it comes to the consistency of the poo, that is much more important. That shows sort of how healthy, how much fluid is actually in the stools. And what you're wanting is enough fluid in the stool that it will come out smoothly in one large piece. So basically what you're wanting is a nice sausage, a nice type 4 sausage. So it comes out nice and smoothly and down the pan, preferably, although type 3 is probably what the majority of people run on, the corn on the cob. So you can see that your body's had to pull out a bit of moisture out of it. So there's a bit of cracking on the surface, but on the whole, you do okay. Although some people, especially some of us with Ehlers-Danlos syndrome who have stretchier intestines, may have larger width corn on the cobs than other people. It is one of the first signs, especially with toddlers and babies. They will actually ask about the girth of the thing to see if there's any sort of underlying sort of issues with the intestines. The other thing to notice is if it suddenly gets really, really thin, that's also another red flag, because that means that it's having to squeeze past something that's in the way, and that's making it too thin, and so that needs looking at. Well, then as people get constipated and more moisture comes out of it, it turns into a bunch of grapes. So it's actually, you can see that it's really pulled the moisture out. They're really hard, solid lumps that can take quite a lot of extra pressure to get out. And type 1 is, if you're lucky, you might get a few rabbit droppings out. Unlike a rabbit who can pop around and drop 200 200 droppings a day. That's average for a rabbit, just in case you ever thought about getting a rabbit. Then you go to the other extreme. So as you're going on to diarrhea, your sausage ends up coming out. It's a bit more liquidy. It doesn't stay in one solid lump and it comes out in bits. So a bit like chicken nuggets, soft chicken nuggets coming out. And then we get onto the obvious things of it turning into porridge and gravy when it is just when it is just diarrhea. However, if you've got, especially with children or yourself, where if you are normally getting a type 2, type 1, and then you suddenly have a type 7 without going through all the ones in between, then what you may actually be having is what's known as overflow diarrhea. And basically that means is you've got the blockage in there, you've tried drinking and eating, and your body's trying to push it through, but that solid lump in your intestines is not moving, and the other liquid just pushes around the outside. Now, this can be really bad for people, because the overflow diarrhea you have zero control about, especially if the solid blockage is near the anus and holding it open. You've got zero control about it. And this is where you end up with lots of toddlers ending up getting shouted at by the parents when they've actually got constipation and they're pooping their pants with overflow, and they have zero control about it. And that's why the Eric resource is so good with that. Oh, sorry, I'm just reading Sam's comment. Yeah, nappy changing is always excellent, especially little boys. So that is always one thing to be bearing. And treating a blockage is when you need to be using a disimpaction regime. So I've not really actually got onto any laxatives yet and explaining different laxatives. So I'll start with the disimpaction regime, which is also exactly the same as what you take for a colon prep. And I know some of you are all experts with colon preps. So basically, if you've got a blockage, you've got to get it out. And we really want to avoid surgery, because if you're going in via surgery, that means actually you cut in through the abdomen and then into where there is the feces and the good and bad bacteria, and then you risk putting them into the abdominal cavity. So anything that you can do to avoid surgery and get the impaction out, the better. Nurses can be great at doing this. And this is the one time, if it is close, that an enema is useful in a medical situation, using an enema. I have linked in my description box below about the use of coffee enemas and how they are not useful. They can be used to disimpact a blockage, but no healthcare professional is going to be using a coffee enema. They're going to be using a pharmaceutically aseptic, sterile enema that's been produced that they can use, and they know full well they're not actually going to be introducing anything bad into there while they're trying to get everything out. And so that can be used. But the other option is to basically try and force it through from the top within disimpaction. And this is where they quite often use the high doses of the macrogols. Now, macrogols are osmotic laxatives, and osmotic, the word osmotic means to pull in water through osmosis. So it's really a high sugary, salty content, although it's a long chain sugar that doesn't get absorbed. I'm assuming you're saying coffee enemas. Yes, coffee enemas are dangerous because it's not it's not a sterile produced product being used properly. They're just getting some coffee and flushing it into their colon and flushing it back out again, and you're risking perforation and everything if you're not a trained health professional actually monitoring it. So yeah, I cover all of that in my coffee enema video. So with the macro goals, with osmosis, so long chain sugars and salts that pull water into the intestines. So the most important thing when you are drinking the macrogols is drinking them with plenty of water, because they're going to be pulling your water out of your blood supply if you haven't actually taken it in. So it actually can cause more dehydration if you don't actually take it in. Plus the fact that these sugary, so the macrogols, they taste of salt. They're disgusting. If you try making it in less water, it doubles the strength of the saltiness and makes it taste doubly worse. So never ever try giving a child their Movicol or Macrogol in less water. It makes it a million times worse. Actually make it up in more water. You're better off using a nice, I'm just showing off my new Secret Santa that I got, which was so cute. You're better off putting it in a full-on tub that, you know, that's what they get through normally in a day. Is that's their cup. That's what they normally get through. Put it in there. Stick a bit of Ribena in there if you want to really try and cover up the salt, and with plenty of fluid. And basically, you just keep pulling it in. It's pulling more and more moisture in the hope that that moisture will penetrate it some into the stool to loosen it and soften it, and literally just push the blockage down. And unfortunately, it is not pleasant. If you've got a blockage, the blockage has got to come out, and when it does come out, it's not pleasant. It hurts. It really hurts. A lot of sympathy to any children that have to go through this. And then you're left with this sort of the diarrhea as the rest of it comes through. And then you've got to try and get back to a normal routine. So this was a question that I'd got asked for on Facebook earlier about sort of megacolon. So megacolon is something that happens, and it quite often happens after that there's been a blockage. The colon has distended because of the blockage. So whereas it should normally be a nice tube, it's suddenly massive because that's where the blockage has been, and it takes a while for it to shrink back down again to its normal size. And during that time, after there's been the dilation of the colon, you've got to be really careful, because just putting normal food and feces back in there is just going to fill back up again and still going to be hard. And so, unfortunately, for anybody that actually had a blockage, they do then need to be on laxatives for the next few weeks or months to allow the intestines to go back down to a normal size of a normal sized tube, so that that the smooth muscle can actually be back to its normal size. So it's a bit like if you stretch out your skin, getting fat and then going back, it doesn't go back straight. There isn't that elasticity. Obviously, younger people, it goes back quicker, but yeah. So yeah, after a megacolon, you do need to carry on. So that's what osmotic laxatives are. Quite often, osmotic laxatives are used for children, and this is mainly because the majority of other laxatives are decades and decades and decades old, and have never actually had that many trials that have been funded by pharmaceutical companies to get licensing in children. So there was only really Movicol and pediatric Movicol that ever actually went out, spent the money to get licensing in children. So that is why Movicol is now sort of the gold standard in use for children. Also, quite often with the conditions being treated in children, it is a matter of keeping it soft and keeping it moving. So when it does come to children, obviously I would always say never ever treat children with laxatives over the counter. We all know previous generations would give weird and wonderful things to ensure their children went every day. I would not do that. If you are insisting that you want your children to have a good bowel regime, then you need to do it with fruit and veg and fruit and veg, fluid intake, good routine, give them a book, sit them on the toilet, that sort of thing. Do not be giving young children laxatives unless you've gone through a healthcare professional to rule out other things going on. And then, yes, it quite often will be a small dose of the macrogol every day. And what is always best with constipation is the preventing of the constipation, prevention of a blockage. And quite often, especially with children, you'll think, oh, they're doing fine. Leave it off. And then suddenly you'll hit a crisis when you realise, oh, they haven't been all week. Oh, now they're struggling. And it is actually better to be a little and often, means that there isn't a problem. It doesn't stretch the intestines out. It doesn't cause a problem. It doesn't then cause a major problem that suddenly you're then having to start from scratch again with a disimpaction regime and going along. So a little and often can be better. And that actually does work for things. It's a bit like lifestyle. Little and often on being healthy is much better than just doing being healthy for January and then forgetting it for the rest of the year. So I'm assuming now this is where all of these come into different names across the thing. Are you US or the UK? So Microlax, as in there's the Microlax enemas, and then there is also the Microlax sachets. But as I was just saying, with constipation, a little regular to prevent the constipation getting bad is much better than waiting until you're bad and then suddenly having to use a bigger amount. So with all of the laxatives, finding the smallest dose that works for you and keeping at that rather than having to suddenly wait a week, then take a whole bucket load and then start again. Yeah. I was going to say, so I'm assuming it'll be the macrogol one, or it could be the picosulfate one. So I'm going to go through trying to use the generic names. So the macrogols is the osmotics. There is another osmotic out there called lactulose. For those of you over in America, it doesn't really get used in America anymore because you've realised. But in the UK, it is still used, especially by more old-fashioned people, more old-fashioned doctors. It's always been the gold stay. People have always loved a little bit of lactulose, but it works the same. It's a long-chain sugar. Unfortunately, it's a long-chain sugar that does get broken down by the bacteria in your intestines. And as it gets broken down by the bacteria in intestines, it also produces gas. And that gas, so the fermenting of the lactulose by the bacteria in your stomach causes gas and acids and a lot of flatulence, a lot of bloating, and it's not very pleasant. So instead of using, some people seem to think, well, lactulose is weaker than a macrogol. It's not weaker. You're just needing to work out the equivalent doses. If you're wanting something weaker than a macrogol, you're best using the pediatric version or a half version, or just making it up and only drinking a little bit of it. So quite a lot of people, even with the half sachet, they might find that they just need a half of a half sachet a day. And that's actually better because it doesn't ferment. The only time that so lactulose is so sickly sweet. It was actually originally invented as a sweetener. That's what it was originally invented of. It was fructose fructose and lactose joined together synthetically, and they joined two sugars together synthetically to try and make a sweetener that they assumed that the body wouldn't absorb, and the body doesn't absorb it. The microbes absorb it and use it. So they tried to make it as an artificial sweetener. So it is like, like 10 times sweeter than sugar. But yeah, it never took off due to the side effects. Nobody wanted the fermenting gas and the diarrhea caused by that thing. As you probably know, the majority of the sugar alcohol sweeteners, erythritol, sorbitol, and things like that, they all act as osmotic laxatives as well and cause diarrhea. So you can read on a pack of chewing gum, may cause diarrhea. Yeah, the other thing about lactulose is it's extremely sticky and yucky, and anybody who's ever worked in a care home knows that the all on wards in the hospital, the medicine trolley is always full of gluc. So anything you can do to get rid of having the lactulose for that. The only time that you would actually use lactulose is for somebody who has got who is an alcoholic and is getting ascites and build up, and it's to help reduce the ammonia levels in the blood and reduce the risk of Wenck's encephalopathy from the alcohol. So that's the only time you would actually use lactulose, and that's because the acid producing bacteria eat up the ammonia that the alcohol's causing to go around the blood. So the osmotic laxatives, they can be very useful. However, they basically do just pull a lot of moisture into the intestines to provide that moisture to push things through. And that, especially in adults, that's not the reason why there is constipation. So one of the main reasons why people are constipated as adults is due to their other medication. So there is lots of other medication out there that cause constipation. Opioids are the big ones, but anything that also causes dry mouth, so things like your amitriptylines, things, yeah, every care worker knows. So with drug-induced, so many drugs, all the ones that were classed as anticholinergic drugs that cause dry mouth, also dry up the secretions in the intestines. And then you've got the things that stop peristalsis, so like the opioids and things like that. No amount of pulling water into the intestines is going to get the intestines moving again. And in that situation, if the intestines have stopped moving and the peristalsis is switched off, you actually need to switch the peristalsis on again. And that is when you would be using what we call a stimulant laxative. And basically, the stimulant laxatives irritate the lining of the stomach, the lining of the intestines to get that peristalsis movement and the soft muscle squidging and moving things along. So the two you probably know is Senna is the big one that's always been used. Senacot comes from the Senapod plants. It's been used for decades. And the one that I prefer, which is bisacodyl, which acts in a very similar way. However, with bisacodyl, it comes in an enteric-coated tablet that doesn't get released until it's further down the gut into the lower intestines. So it doesn't cause as much griping and irritation in the top half of the intestines and does more of its work once it gets down to the large intestines and the colon to move along. But if somebody's got opioid-induced constipation, you need to be thinking about getting that constipation under control before it starts. Because as we've talked before, if you get a blockage and then you're gonna be in big trouble. And quite often these patients have plenty of other things going on with their health if they've already been put onto an opioid. So that's the thing. And then we're going to move on, finally get to it. My favourite laxative, which is the one that I actually think is a good all-rounder and actually treats lots of different types of constipation, and it's what's known as a softener. And this is docusate, and it comes in capsule form. You can have it in liquid form, but it does taste disgusting. And it's a softener, and it helps with allowing water to actually penetrate into hard stools. So if you think of washing up liquid allows oil and water to mix, well, sometimes it can be like that with your stools. They're hard, they're solid, and the water just can't penetrate. And the docusate acts to allow the water to penetrate. It also does allow it to soften, and then it also makes it a smoother outside so that your body's peristalsis can actually move it along and it doesn't get stuck as much. So they're your three main groups: is your macrogols, your softeners, and your stimulants. And then there is the other one, which is, I've already mentioned at the beginning, you've got your fibre bulk forming. So the fibre for bulk forming, we would always produce to get fibre, your bulk forming from your diet. It's always best if you can get your diet it from your diet, because then it comes along with all the other micronutrients that your body needs. If you're filling yourself up with just a fibre supplement, then it doesn't come along with all the good micronutrients that it does if you're coming along with getting that fibre in fruit and veg and such like. So I'm just going to go through some of the questions that I got asked at the beginning. So somebody said, how often can you take picosalax, which is a mixture of picosulfate and magnesium? And you probably already know that magnesium is a supplement that has a laxative effect. So you probably see many detox and cleanses have magnesium added to them, and they'll try and tell you that magnesium is this amazing supplement for your body. Basically, it's a laxative, and because you then have a laxative effect, you feel as though you've lost pounds because you've lost stools, and that's how it works. Yes, you may need to have magnesium added to your body, but quite often it's usually magnesium oxide in these laxatives that doesn't even get absorbed into your body. So magnesium and picosulfate. So they're both stimulant laxatives that basically are just causing out. How often can you take it? Well, as I said earlier, little and often is better, so that you're not needing to wait until you've got a blockage and then taking it, and then you may overall need less. But depending on the reason and the cause of your constipation, you may need the dosing continually increasing. If there is an underlying pathology, or you're on higher and higher opioid doses, then there can be reasons that the dose gets increased up. Now, if somebody is on just one laxative, and that one laxative is getting up to the dose that it should, that's recommended, I would always say a little of a few different laxatives quite often can work better together. So having a little bit of a stimulant to get the peristalsis moving, a little bit of an osmotic to pull the fluid into your intestines, and then a little bit of a softener to allow that water to penetrate into the stool and make the stool smoother to pass through. A little bit of all three can work better than a massive dose of one. Whereas if you're only using the osmotic, you're going to get a lot of bloating. If you're only using the stimulant, you're going to get a lot of cramping. And if you're only using the softener, you're just going to need to use higher doses for it to be working. So sometimes if you are getting to the point where you're on a high dose of one laxative, it can be looking around. And then also then going back to the original things of what's causing it. Can we remove what's causing the issue? And can we do anything else around lifestyle to help along? So the same answer to the next question was, I got asked, was how many softener pills in one day in one go? Now, quite a lot of these different laxatives, they don't work straight away. So a stimulant can be from 8 to 12 hours it can start working. So that's quite often why they say take it at night, so that when you wake up in the morning, when usually you eat your breakfast, and that's usually when most people's bodies switch on and then need to do a bowel movement, that's how they do that. And then sometimes if you're needing more than just a dose at night, you're adding a dose in the morning. When it comes to osmotics, usually when you're needing the higher doses because of the volumes required, you quite often then spread that out, maybe start off once a day, twice a day, 3 times a day. And because of the amount of volume, you might spread that more often throughout the day. But usually it's once or twice a day, usually at night to start with, and then adding in the morning. And then, so I've done the safer thing. So, yeah, so I'm going to go back up to DC's original. So what was the least harmful laxatives you can try when struggling with constipation? So if you're struggling with constipation prior to going to a healthcare professional, then the best is to do the lifestyle advice, fluid intake, fibre, exercise. One of the bits of lifestyle advice that I forgot to give is the position when toileting. So I've already said with toileting is you're best not to rush it. You're best to pick times of the day that you're more naturally going to need to do a bowel movement, either after exercise and then allowing yourself to have sort of 10, 15 minutes to just sit there. Take your phone in. I'm not bothered. Other people might be with germs, but if it means that you think, just make sure you wash your hands and maybe even spray your phone. Right, so yeah, so time of day after you've eaten. So quite often people after a main meal or even after breakfast, going and having sort of 10, not rushing, and then also the position that you sit in. Now, the most natural position that actually relaxes the anal sphincter and the muscles around the anus is the squatting position. Think of a dog. In fact, think of pretty much every mammal in the animal kingdom, and the position that they go to is a squat position. Think of every toddler that still does it in their nappy. They go in a squat position. That is the natural position. Even babies, they will pull their knees up into a squat position to poop. That is the natural position. Unfortunately, Western toilets are designed that you are not in that position, and you've actually got your knees are below your hips, and you're not in that correct position. So I am a advocate for what's known as the squatty potty, which is basically you just get like a toddler stool and put it under your feet to higher your feet up, so that you actually your knees are above your hips. Then try and straighten your back and lean forward with your back straight, so that you're actually getting that sort of bend in your hips. And then and this is one I learned, there's a great doctor on gastroenterologist on Insta that I follow, and make a moo sound, because doing that helps relax your pelvic floor and allow it to come out easier, and then just not rush and allow. So I'm all for the squatty potty. Obviously, you could go Eastern European and have a proper squat, hole in the ground, but that's just not practical for the majority of people that have got dodgy knees and hips. So having a little stool that you can pull in and pull out can really make a difference. So obviously, the least harmful laxative when you're struggling with constipation, work out what the cause of it was. Was it because you've taken some painkillers with codeine in that stopped your peristalsis? If so, then it will be a quick dose of either the Senna or the Bisacodol. I think it comes as Ducalax in the UK, so either a Bisacodol or a Senna stimulant to restart your peristalsis, because your peristalsis has stopped. If it's because of you've been dehydrated running around, then increase your fluid intake, and you are probably best then taking something like a docusate, which will then allow that water that you're drinking to then penetrate into your stools. In this country, you can't really buy macrogol over the counter. You can. It is available over the counter. It's just when you go to the pharmacy and ask for it, it's quite expensive. So Duclase is the easier one to get. Or you can go and get any bulk forming fibre supplement if you know that you can't get fibre in your diet, maybe because you've got problems eating certain products due to allergies and such like. So you struggle to get the fibre in your diet. The other thing to do is there are certain fruits and vegetables that actually have natural laxatives in them, such as sorbitol. So pretty much every fruit that has a P, so peaches, plums, pears, and such like, they all contain sorbitol, which is a natural osmotic laxative and helps pulse your prunes. I knew there was another one. Your prunes, they all have natural laxative in them to help. Do laxatives interfere with prescription medicines? Sometimes, yes. So there are some medicines that do say that you've got to keep away from other food and such like. And I would say that I would probably keep them away from laxatives as well. But not really. It's more the fact that if you overuse laxatives and you've got slow release medicines, they may end up coming out your system too quickly that the can't slow release. There is a problem between macrogols and certain thickeners, but that would only be a problem for people that look after people in care homes with swallowing difficulties. So I think I answered your other questions. Oh, I think I covered that. So things before resorting to think. And hopefully I covered that with osmotic. So I'm going to go back down to the bottom and see what I've been missing, because I can see yeah, oh yeah, so the microlaxes, I think. Yeah. Oh yeah, love the poop skull. If you want to look, there's a great video about the squatty potty and the unicorn. It does make very much easier, but I can't say about the pregnancy bit, but I'm pretty sure that by the end of pregnancy, you probably cannot get into a squat position very well. And that probably also takes me to another reason for constipation, which is pregnancy. And this is also, I think we're mainly ladies here, or we're mainly people with uterus is here. So anybody who's got a uterus and has been subject to hormonal estrogen and progesterone throughout the month, there is something known as the period poops. So progesterone and relaxin are two hormones that get produced by the body in increasing amounts during pregnancy, and they help to loosen up the pelvis and the uterus and everything, so that the baby can grow, expand, and then finally get through the pelvic floor. While it's doing that, it also expands the colon and the intestines, and makes it more likely that the stools can expand and grow larger and wider in the intestines. And that's why pregnancy can actually cause so much constipation, and why it can be best from the start of pregnancy to make sure that everything is done to reduce the chances of constipation. Another reason for constipation is having to take iron supplements during pregnancy. Iron supplements can cause constipation. I have done a video about iron supplements, that you might be taking too much. you only need 1 a day of iron tablets, and that's all your body can absorb anymore, just causes more constipation and more black stools. So the guidance has now changed for all GPs across England now. It's only 1 tablet a day for ferrous sulfate tablets. But yeah, taking iron tablets can cause constipation. Also, that same progesterone that relaxes all that smooth muscle, relaxes the smooth muscle at the top of your stomach, causing reflux. So as well as the baby pushing the stomach up into your esophagus, the progesterone relaxes it and allows the acid to go up into your throat as well, causing that acid reflux. But all of that can cause constipation. Plus, that same increase in progesterone happens during the second half of your monthly cycle. So some people can have very different, especially if they've got irritable bowel, where they can have constipation really bad for 1 week of the month, and then as they start their period, they suddenly then get the explosive period poops, which I don't need to explain. You can Instagram that one. Yeah, so hypermobility, hips are rather bendy, and anybody with EDS and hypermobility, you are quite often can be more prone, if you are of female hormones, have them cause your hips to get more and all your joints to get more floppy round the week up to your period. So a lot of people with EDS can have a flare in the week before their period. If that is particularly every cycle, you're finding that's a problem, you can discuss with your doctor on whether you want some hormonal treatment to just try and smooth things out so that you're not prone to your hormones every month. Interesting. My bathtub's not in the same room as my toilet, so that wouldn't be practical for me, but we do always find interesting ways. Right, so I've been on for an hour and a bit. I've covered quite a lot. I haven't even got onto much about sort of the fact that I'm just looking. Do laxatives affect gut bacteria? Yes. Yes, they do. So being constipated affects your gut bacteria because in a way, it quite often leads to more of the bad bacteria getting a hold. They seem to like being constipated more, probably because it's the good fibre that the good bacteria like that help keep off the constipation. When you don't have all that nice fibre for the good bacteria, that's when you get constipated. But yes, if you're relying just on laxatives rather than fibre to feed the good bacteria, you can just be flushing out all the bacteria. And what's the most important thing with your gut microbiome is variety. And you want to be having lots of different variety of bacteria in there. So the quicker you're trying to flush things out or just pulling in lots of water rather than providing them with nutrition of the fibre, it does affect it. So I have put some resources in the description box below. So I'll just go through those. So as I said at the beginning, so there's the Eric bladder and bowel, excellent resource for anybody with any children. It's my go-to for anybody with any extra children. Gut health, lots of stuff about gut microbiome on here. They did have a one about sort of does your laxatives, do other medicines affect your gut microbiome? I thought that was in that first section. They'll probably put more on. Constipation making reasonable adjustments. This one I was going to share. It's about the fact that people with learning disabilities are much more likely to suffer from constipation, variety of different reasons, underlying pathology of sort of things like Down syndrome and cerebral palsy, but also they're just not given the same access to good education and lifestyle and the ability to get that, and that needs to be sorted out. So that's an interesting one. And then I have left a links to the actual guidelines that I've wrote, just in case anybody's actually interested. And I have just realised that they're up for review this month, so I get to have fun double checking all my evidence is up to date. So yeah, love having you all on again. It's brilliant. I think Julie Joe is live if anybody wanted to jump over there. Oh, yes. Does caffeine have an effect on the bowels? And actually, coffee is good for the bowels. Coffee and caffeine. Caffeine is a stimulant to the brain, but it is also a stimulant to the gut, and it does actually increase gut motility. So having your coffee in the morning does help start your bowels for the day. Plus, a teaspoon of coffee does have a couple of grams of fiber in it. Plus, it has all really useful polyphenols that help feed the gut bacteria. So yes, coffee is good for you. Caffeine does increase your bowel movements. So yeah, although if you want your coffee, drink it orally. Get whatever tastes nice, whatever you do not stick it up your butt. And I've got a video to prove it. So, yeah, thank you for being here, Sonia. Great to be on with that. And I've lasted a lot longer than I thought I would. So, about 6-7 weeks ago, I had a horrendous virus that knocked me for 6. And since then, I've been wheezing and struggling. And the doctor's been trying to work out whether I've got adult onset asthma, long COVID, or something else, and done every test under the sun. I've then had another virus on top of it because basically my body just hadn't got used to getting off it. And then I spent the whole of yesterday in bed with a migraine, which, even though I know all the migraine advice, sometimes you've just got to lay in a dark room. But I have got I did do a previous live stream on migraines if anybody's interested. But thank you all for joining me again. And if you get to this point, if you can then leave a comment when the video gets published to give me a 5 poop rating. So if you can do the poop emojis and give me up to 5 poop emojis on how much you enjoyed this, and I'll know how many of you actually managed to get to the end. So thank you all for joining me. And I'll try for one in 3 weeks' time. If you've got any requests, put them on my community tab or send them to me via a DM on Insta. See you all. Bye.